So we've been hearing a lot about miracle drugs, Cam.
Magic that can fix all of our problems.
Damn it.
Where was this shit before?
So on this episode, we're going to talk about a miracle drug that might not really be a miracle, but it could have some benefits. We're not taking anything away from it. Stay tuned. What's going on, guys? It's Pat and Cam, and we're going to be talking about miracle drugs today. So, Cam, I'm sure that you've experienced this in your practice. We're going to talk about the semaglutide and the GLP-1 drugs today. Just
Oh yeah.
because I think we've talked a lot about this off camera, but a lot of people have approached me, and I'm sure in your pharmacy as well. Is this really a miracle drug? So, like semaglutide, aka Ozempic, Wegovy, Manjaro, not so much Trulicity. I don't think that has the studied weight loss benefit as some of
I
these.
mean, but essentially it's going to be a class benefit because that's just how the medication works.
Right.
So it may not have been, shown or proven to do that or being prescribed for that reason specifically. It still will have that benefit to some extent.
Sure. And so, you know, maybe you can elaborate a little bit more on it, Cam, but the way I've kind of been describing this class of medications, the GLP drugs, to people is that they're kind of a glorified appetite suppressant.
Yeah,
Um,
exactly what it is.
so, there's there's some other ways that you can achieve this, probably a different uh, talk for a different day, but, they're through supplements and certain foods and things that activate this. But the big thing is I've had a lot of people ask, well, is it really a miracle drug? I mean, everybody seems to be losing weight. The med spas around my office here in Tampa, Cam, are calling it the Hollywood skinny shot, which I don't.
Jesus.
You haven't heard this yet?
I have not heard that. No.
Oh, great. You're in for a treat today, buddy. So, yeah, there's a lot of so I've got a wellness spa right down the street from my office, and I've got a lot of these places that are offering the weight management, weight loss therapy. And you see it's really scary. You'll see them put up on the sign, Hollywood skinny shot here, like not even kidding.
Jesus.
And so basically people are going in and they're getting the semaglutide shot, and some people are getting prescribed the other medications, but I think semaglutide is probably the hottest topic, just because earlier in the year I know we were experiencing a shortage in that class of medications as well.
It was the tail of last year, and we're still kind of having issues with it now. It's slowly kind of getting back to decent availability. It's not to where it was by no means, but it's definitely going to be a lot more available than what it was back in December, where you weren't getting that to save anybody's lives.
Yeah, and if I know that you have a lot more experience on this, but from what I remember is that there was the discount card, right, that would work with insurances. And so you would go on the website, I think it was Manjaro. You could go
Yep.
on the website, and then I guess the doctor would write a script for you, and I guess they could write it for off-label for weight loss. And you could go on the website and you had to click two boxes, and it was two boxes, and one of them said, you have to have type 2 diabetes for this.
It was like, is this being used for type 2 diabetes?
Right. Oh, yeah, it was one box. Sorry. So it was one box
And
used.
then yes or no.
Is this being used for type 2 diabetes? Yes or no? And all you had to do was click yes, and then you would get the discount card. And that, with the sexiness of this quick, rapid weight loss medication, was really probably hitting you guys really hard in the retail setting. Yeah.
Oh yeah. Oh yeah. People were getting that stuff up so fast it was impossible to keep up anybody's demand. And the big concern is it is Manjaro specifically, and let's be honest, Ozempic for that reason as well. It's indicated for the treatment for type 2 diabetes. The weight loss stuff is a non-label indication for it. It's just used for that. There are products that have been made via the same medication. So, as we just mentioned, Wegovy is Ozempic's or semaglutides, a weight loss version. That one is indicated for weight loss. But when it first came out, there was a coupon on it, so I did see people using it before, but I don't think there is anymore. So no one's getting that anymore just because it's not covered, because weight loss medications are typically not covered by insurance plans. That's not an umbrella term. You know, some plans do have it. There are some like prior authorizations or things that may allow it to be covered. But generally speaking, weight loss is considered cosmetic and they don't cover those things. So people aren't going to pay for essentially it's a brand of a medication for weight loss at full value or even a high partial value. So that's just, pushing people more to use these newer products that have coupons and then just check the yes box and get it filled. So that was last year. I believe it was like late summer, fall time it started. But then as the popularity kind of grew, and I'm sure the company started to notice that their product was just exploding in the market, they did put a little bit of regulation to it. They wanted some, I don't know if they were exactly how they monitor it, but they were either requiring some diagnosis codes on it, or there was some further like verification that it was going to be used for diabetes. So if it was coming back that it was not being used for diabetes, but be used for weight loss, they were actually rejecting the $25 coupon, and it was still heavily discounted. I want to say it was like a third of the price. So instead of it being like $1,600, $1,200, it was like $400 or $300. But that's just for a single month supply. And often patients would still pay for it because it's this new miracle that's going to, cut my weight, make me healthier, and all I have to do is inject myself once a week with it.
Right. Let's not forget to make you sexier too, right?
Oh yeah, that's what everybody wants. Everybody wants to feel that good sex.
Yeah, and I think now I'm interested to see what happens. In late March, it's beach body building season and stuff. So interested to see how that's going to hit the pharmacy market. Or I'm not really in on the retail space, but I'm sure there's going to be some interesting things happening with these drugs coming up.
Oh yeah, and I think the big thing is going to be will it continue to be covered or supplied with a coupon, and the actual supply itself. Because as the way we kind of touched on a little bit earlier is the way these medications work essentially is it'll suppress your appetite. So now you're eating less. You feel full. You don't feel that you feel satiated, as what it is. You don't feel the need to eat as much or continue eating. So you'll lose that weight. And then now let's fast forward to May. You can't get it. So you're not able to take your dosing. You're going to have that hunger kind of returning and you're going to be eating again. I've already had patients who started it, October or something last year, couldn't get it November or December. And they're already saying like the weight's already coming back. They're already putting the pounds back on. And it's like, that's just the way the medication works. Like if you're not eating, you're not having that caloric intake at the same amount, you're going to lose that weight. And then as you're returning to that diet that you had initially, your calories are going up, that weight's going to return. It doesn't melt the fat off. It doesn't like displace it into some weird paradigm shifted fucking tesseract, whatever it is, kind of space thing. It's just you burn it off and then you're going to get it right back on it because it's not changing anything. I think another concern is that people think it's like a manufactured drug, like it's something we've created entirely. They don't realize that it's actually a mimic of a peptide that we have in our bodies. It's the glucagon-like peptide is GLP, and it's something that you would have naturally. And for some patients, it's either not produced as much or the response is suppressed. So now you're just increasing that, quote, natural peptide that's found. So this is not like a drug that's going to help anything. It's just your body's normal functioning kind of being boosted up with some extra or being returned to normal depending on your specific condition.
Right. I do want to say I've actually consulted with someone who had this issue, type 2 diabetic, insulin dependent, big time insulin dependent, like had a very high sliding scale. And her doctor had prescribed her this medication. Unfortunately, so she came to see me because her doctor had prescribed her this medication. I think the problem was she was a little bit confused by it because it was a lot like insulin and the fact that it was an injectable near the belly, and like a lot of the rules were conceptually the same. And I think she perceived it to be like insulin. It is not like insulin.
It is not.
And what I do want to let everybody know is that if you yourself or know someone who is type 2 diabetic that is also insulin dependent and they get started on this medication, they have a very high risk for hypoglycemia, which can be life threatening. And the reason that is because you've stopped eating the normal amount that you eat. And so now you have to adjust the insulin to that amount. It sounds silly maybe, but I don't think that it's either tough to get that much education across, or the education isn't being provided, or the patient's like, oh, this is like insulin, I know what it is, and they leave and they're not getting what they need. So, please ask questions. So that we have to emphasize that. Like, we're here to answer the questions, but and we will probably ask you about it and provide information. But the thing is that, like, also we don't know what you don't know, so you really should ask. But this lady had a bout of hypoglycemia. She had told me that her blood glucose had dropped to the 50s, had to go to the hospital, and just wasn't aware of that. She wasn't really even conscious of the fact that she was eating less. So please be aware that, these things can happen where a new medication, well, in theory, it doesn't necessarily cause hypoglycemia. The fact that you're eating less and not making adjustments to other regimens can cause hypoglycemia or other issues, like if we are talking about other medications as well. So valid, like what counseling point, as they say.
But yeah, it's a huge mark on that point right there. Is it is a medication that's not first line. So you've seen it recently because of coupons and the desired weight loss, but typically
commercials, drug advertisements.
Exactly. I wonder where they got this idea from. It's crazy. But they will start this medication, and it's like the first quote diabetes medication they have. Shouldn't be that way. Most patients should have started off. We were talking before about metformin in a previous cast. That's typically first line for medications when it comes to diabetes. So they should be starting from the bottom and kind of working their way up. So at this point, most insurances as well won't cover it unless they've tried the tiered therapies. So they have to go through those steps. So at this point, they're probably on insulin. They're probably on maybe some, glimepiride or glipizide or something like that they take with meals to help squeeze out some of that extra insulin. So the last thing you want to do is to start this new one, think it's like insulin, even though it's like a metered dose. So you think it's a metered dose of insulin. And then now you're taking all your medications as you were written, as you're supposed to, but now you're not taking in that sugar. So then you go in that hypoglycemia. Because I have a lot of patients who they think it's insulin. So they come in, they're trying to get it refilled, like, oh, we don't have any. We expect it, the end of the month. We're not really sure. And they're like, oh, I have to have this medication. I need it. And it's one of those things where it's like, no, you don't need it. This one is not life or death. This thing will not prevent you from dying directly, in a sense. Whereas insulin, you can die without having the insulin or having too much. Very important. This medication, you're not going to have that problem with by itself in like its own mechanism, theoretically.
I can see behind the counter at your pharmacy going, but did you die?
Yeah. Oh, I am kind of an ass to these people sometimes because I can understand it's stressful. I do get that the gravity of the situation is kind of heavy. It's kind of a pain. But then they're like, I gotta have this. If I don't have it, I'm going to die. And it's like, you're not going to die. It's like, you don't have to have this. You don't need this. This is a want kind of medication. It is, we live in that first world and we got to have it because we saw it on TV. Like, fuck no, you don't.
Fair enough. Yeah, so we can kind of go into the medication a little bit more. And I mean, these medications, we've seen them lately because of the sexy term, like the Hollywood skinny shot and whatever they're calling it now. But you really do lose weight. I mean, I've seen people drop a tremendous amount of weight in a short amount of time. That's not really that healthy. I actually had a physician in sauna the other day argue with me and say, oh, but it's cardioprotective. And I was like, well, not if you gain all the weight back.
Yep.
And so cardioprotective means it's helpful for your heart. And the component would be that in, theory, like you're losing weight, you're reducing the amount of fat that you have on your body, and potentially like helping, if you have diabetes, helping your diabetes, and overall just probably helping yourself. So yeah, it's cardioprotective. Now, a lot of these studies are showing that when patients are coming off these medications, like Cam said before, the weight's just coming right back on. And I've seen a few people who I really like reading people's testimonials online of like when they use drugs or supplements, just to see what it's doing for individual people. And I saw a lady's testimonial, and she managed to lose like 120 something pounds, like lost a considerable amount of weight. In that time of losing the weight, she also made lifestyle changes and has continued to keep the weight off. But when she was talking about her diet and how it's changed in her exercise regimen and all the things that she's done, so it's like she went from eating a lot of like cheeseburgers, fast food. She said one of her big things was fast food. And now she cooked for herself. She ate a lot more fresh food, whole foods. And she's maintained that practice. She's also working out more. So yes, this drug is going to help you lose weight. There's no doubt about that. You can get to a safe weight, but you can't go from cheeseburgers to semaglutide back to cheeseburgers. And we'll say fast food. So you're not going to go like fast food, processed foods, semaglutide back to fast foods. Like it's not going to work. So again, like we kind of discussed in a previous pod, there's opportunity to make lifestyle change and use the medication as a tool. But if you're going to go out, eat, drink, like do all the things that you've been doing and you're overweight, and then start this medication, you'll lose a bunch of weight still doing those things, but just less. So now you lose weight. Don't be surprised, because basically you're turning that switch back on and you'll just want to eat more again. So it's a waning effect. And then also there are some complications. Cam, maybe you probably go into it a little bit more with taking this medication, I think for long term, especially if you don't have type 2 diabetes. Have you heard about any of those?
Well, I think because a lot of them are so new, there probably isn't a whole lot of long-term, like full development, long-term kind of things with that. So haven't really heard too many of it directly. But I know your big side effect concerns could always become more problematic in the, as you go down the line. So a lot of people do get some issues with their GI. They get, diarrhea, upset like that. So you may become intolerant to them over some time, due to that kind of thing. I've heard a little bit of stuff with like some dizziness and changes to your heart rate, but again, that could be variable. That could be a lot of different things, not just this medication by itself.
I gotcha. I know I do, work with a couple of docs that prescribe this stuff, and they are pretty convinced that like their patients that are on it for weight loss, they stop it at like 8 to 10 doses and they space it out and then they stop it. And I was like, why do you do that? I haven't read anything about it. I'm a young pharmacist. And I guess that they're saying that the black box warning for medullary thyroid cancer for this class of medications. And they said that it's just helpful with that. And it's helpful to maintain the thyroid function. You are kind of like giving your body a blast of peptides that is greater than the amount you might normally consume. So, messing a lot like with physiological function kind of can throw off some regulatory things, very similar to testosterone. If someone goes on TRT, their body stops naturally making it. So it's kind of one of those similar things. So not taking it, look into it. 8 to 10 doses is kind of what they're saying. Then they're stopping their patient. Then they have to be off of it for a while before they reintroduce the medication. So that's probably a lot more than what you guys want to hear. And frankly, every provider is different. So like you'll go tell a provider that you heard that on a podcast, and then they'll tell you that you're full of shit, and then we'll tell them to suck it. So,
go back and forth like that. That's kind of
figures
something I figured we get into is some of the contraindications for that too. So again, a thing you're supposed to screen your patients for whenever you prescribe these things is things like that, endocrine neoplasia, medullary thyroid cancer, and there may be some connection to some pancreatitis. But again, these things are brand new, so they're direct link. We don't really know. It's just kind of theoretical right now. But some of that can be pretty bad, where some people have had like hemorrhagic pancreatitis with possible necrosis there maybe it's from these medications, maybe not. It's still really new to find out. So I think it's schedule where you're going first, screen the patient, but then if they're good to go, a schedule where you're doing it for a while and stopping actually makes a lot of sense. That's how these weight loss medications should be. You see that, we think with phentermine, that one's a controlled substance, and its idea is to speed up your metabolism. It's supposed to, like, quote, jumpstart a diet, kind of get you started on that pathway for weight loss, but you're not supposed to be on it for your life. You're supposed to take it for a little while and then stop. And then that's when you're supposed to use your common sense to be like, oh, these changes I've made, the dieting, exercising, those need to be sustained. Then I come off these medications and now I can control the weight via that. So it's not supposed to be a long-term thing. So for weight loss.
Yeah, the phentermine is also, I mean, that's a stimulant medication that they just noticed also had like a great effect on the appetite, on decreasing appetite. And so it got prescribed. What I remember about it, it got prescribed in just very small doses, and people would take small doses like a couple times a day, and it would suppress their appetite throughout the day. So they weren't eating as much. But that was a while. I mean, that whole fad like craze, I think, happened when I was in my 20s.
Yeah, it's still super popular. Now
Yeah.
typical dosing is like 37.5 milligrams. The tablet you take should be once a day, but some people, they'll take it to, some people are on 3 times a day, depending on their specific, status. But it's still super popular, and people, again, think they have to have it. They have to be on it. They don't realize it's not supposed to be a long-term problem. It's only for people. Majority of the cutoff is a BMI of 30 or higher. So for a lot of people that come in, they have a BMI of 27. It can be indicated for that, but now you have to look into their background to find some reasons on why they could be on it at 27, because it's not approved for that unless there's other comorbidities. So now you're asking questions, you're calling a prescriber, and you're getting into all this kind of work, just really for the appropriateness of a medication they think they need. But that's practice side, so it's not really here nor there. It's just me bitching stuff.
Yeah, that's a whole different rabbit hole that we'll probably, hopefully, never have to talk about on here.
No, I don't think anybody actually really cares.
Yeah, nobody wants to hear that. So, but yeah, so and then move on. So I know that a couple of the docs that I work with, they do screen their patients for thyroid every time. So they pull thyroid. They either want you to have thyroid blood work that's happened in the last like 3 months, or they make you pull a new thyroid panel just to make sure everything's functioning. Your thyroid does a lot for your body, and just as far as like regulating your metabolism. So keep your thyroids healthy, guys.
Yeah, that's actually super good practice right there, because most of the time you get these scripts sent over and they're from a doctor in Miami, or they're from a doctor over in Jacksonville. And being that we're centered around Tampa here, no one's driving 3 to 4 hours to get a screening done to get this prescription. So telehealth is really kind of putting a lot of problems into this, because a lot of these medications, you should be doing some kind of lab work, some kind of follow-up, and most of the time, now it's not, across the board, most of the time you can't do that from 4 hours away, and it's not logical.
Right. Or it's like, hey, buddy, what was your thyroid today?
Yeah. Like, how are they going to know?
Yeah.
It feels pretty good. It's still in there.
I mean, I guess like if you're doing telehealth, they might screen you out and say, are you on thyroid medications? That could be a screening, but.
Well, I mean, they could also like send them to, like, if they have like a Quest or a LabCorp or something local, they might send them to get blood work pulled there, and then the results are sent to the doc. So it's not, like I said, it's not impossible. It's just kind of improbable.
Right. It raises question marks.
Exactly.
I do know that there's a lot of compounding pharmacies. I mean, probably another aspect of pharmacy that our listeners might not care too much about, but a lot of compounding pharmacies are like smaller pharmacies. They kind of have to have a nice niche to keep them in business. Just the way that the current like corporate pharmacy structure works. You can look into all that yourself. If you have any questions, you can message us, but that's neither here nor there. But a lot of these smaller compounding pharmacies specialize in something, and that really helps their business. So, you might have like a pharmacy here in Tampa. It has like apparently the best cough medicine, compounded cough medicine. That's what keeps them thing.
It's going to raise a lot of questions, but yeah,
I know we're going to keep it at that.
there's some red flags going for that.
But there's a lot of these compounding pharmacies that have gotten into compounding semaglutide. One, because they can offer it to their patients at a much reduced rate. Two, it's also because, you know, some of the what I like the sexy medi spas that are calling them the Hollywood skinny shots are able to buy them at a reduced rate, and you know, the profit margins are still pretty tight. So those are some other things to be aware of. I've read some articles, don't know like the validity of all this, but if there's a way to background check like your pharmacy, try to make sure they're not getting products or, you know, medications made like in China or India, because sometimes like the purity isn't tested the same out there, if it's even tested at all. And people are getting the semaglutide shots and they're not effective, or they're having a reaction. They're just, so some of these base products that they're using to compound might not be the greatest and could even potentially be adulterated. So like, please be aware of what you're injecting into your body. I mean, there's a whole different side of drugs. There's a whole fentanyl craze now. What I think that the fentanyl thing is probably at an epidemic level in its own right. So we gotta really be vigilant about what's in our drugs or medications, and what just even what we're getting from a pharmacy and a medical grade facility. Not just.
But to further poke into that, though,
Yeah,
it's kind of important to understand what we're saying here is most of the drug products will come from overseas. Now, the concern though is it a company that is vetted by the FDA when it comes through? Because people have gotten access to companies who make products, whether it's the active ingredient or it's incipients, the other stuff in the medication, that is not vetted through the FDA. It's kind of shipped over, I don't necessarily want to say illegally, but it's kind of just not screened, and it's not checked with USP standards or any of that kind of stuff, and it ends up in the medication. That's where the problems can kind of rise. You can't just go to the pharmacy and be like, I want no Indian medication or no Chinese medication, because they're like, all right, well, we have nothing for you. A lot of stuff is made overseas, so it's not that specific. You just make sure that it's not, and that could be a can of worms, because if they are getting something that's not really been vetted, they're probably not going to tell you that. But it's, you know, a question you need to have.
Yeah. It's just, I mean, we look at this from all angles, and stuff we've seen and read about, stuff that doesn't, you know, necessarily always hit the news. It's just like super like sexy fun pharmacy nerd news, but not like the average person would even care. So just, you know, this is about informing, and these drugs they can be good, they can be beneficial, but like anything, we really have to, you know, when we're concerned about our health, we have to worry about like what we're putting in our body, just because there can be excipients, like Cam said, or there can be just adulterated medications. So make sure you're getting your stuff from as credible sources as possible when you're buying, even when you're buying supplements online.
Yeah, it's a big one.
But a lot of these places will have labs that are accredited that will check them. If you're looking at a supplement that has no accreditation on it, that's a little sketch, just because a lot of these supplements aren't regulated by the FDA. You could be putting anything in there. So if you're at least have some supplements that are regulated and they show, you know, what labs they get tested at or what certifications they have, you can always cross-reference that and see how reputable that is. And, you know, and that way, you know, how pure the things you are getting. And just, you're really reducing the amount of risk that you're taking when you're getting something that's not regulated.
Exactly. You can always check into those things. They will have, if they have been checked by somebody, they will have that information on the tag. And just remember, like, just reading the label can also help. It is unlawful, it's against the law for them to make claims that they can cure things. So if you're getting a medication and it's saying it's going to cure your diet, not medication, a supplement or something that says it's going to cure your diabetes or cure your migraines or things like that, be aware that they can't say that without it being a drug, essentially. At that point, they will be going through the FDA if they make those claims. So then it'd be classified as a drug and not a supplement. So kind of read the bottle. If it starts making some crazy claims, you know you're probably getting bamboozled.
Yeah. So I'm going to take a hard right turn here. Don't buy anything for your dick from a gas station.
Yeah, like I feel like it's common sense, but
Yeah, we've said it a
have a
lot,
business.
but you can actually look up. There are FDA posts about medications that, or not medications, sorry, like I guess like stuff you buy, like horny goat weed type stuff or the royal jelly stuff. Um, that is at a gas station. I don't know if like here's the good or bad thing. Like, do we tell them or not? Right? Because they're going to be like, oh crap. But so some of these, the FDA put posts out that some of these things that you buy at a gas station can actually have tadalafil in it, which that's an ED medication. We talked about
Cialis.
Cialis. But this, you know, so you nobody knows it has it. It just says on the packaging, it'll say, I've gone to do some investigation at some of these gas stations, and I'll look and it won't say anything on it about, it'll just say like, oh, this is a royal jelly with ginseng and like, you know, some other herb in it, and it helps you be big, strong man. And then like, you know,
Helps you have banana.
yeah, there's like horny goat weed, there's all these other things that are out there, and you're reading and it's like, okay, well, this looks legit, but you know, these companies, they want you to get the extra boost, they want the kick, right? And they want you to go, oh damn, that really worked. And so again, these are not regulated, and the FDA has found that there are erectile dysfunction medications in there. They have contraindications. They can be potentially unsafe to people who are on other medications or have certain conditions. So just don't buy stuff at the gas station. Like, just, you know, get it from a reputable store and make sure that there's some kind of credentialing on it. That's like the safest way to do it, because,
Yeah.
you know, crossing up medications, even if it's a low dose, can be pretty dangerous. And we don't want to see anybody suffer. And frankly, I've thought about it when I was in the gas station, like looking at these meds, like doing research for the podcast and stuff, like what's in them and then what the FDA said. I was like, how, I mean, that'd be really embarrassing if you like died from like a gas station dick pill.
Yeah, right.
Like, what would my family think? You know?
Yeah. You at your funeral, like, yeah, it's a dirty old man right here. Like, what the hell is his problem? His shit's so weak he can't even take this fucking what is it called, that shit? Fuck. Spanish fly. He can't even handle Spanish fly. What a bitch.
Yeah. That's so funny. But yeah, so we'll round out a little bit on semaglutide. Also, some side effects. Anything that messes with the GI or like eating, you can always experience it, nausea, vomiting, diarrhea. Some people that I've talked to that have done the semaglutide, they say on their first couple doses they get some pretty pronounced diarrhea.
Yep.
That's one thing I don't really hear a lot of people talking about, except for the people taking the drug. They're like, yeah, I had some pretty significant poop there.
Yeah, and there's like I just kept going and it's gone. Or sometimes it could be dose related. So a lot of these medications are adjustable, like not the pens themselves, but the dosing. Don't go wrenching on your fucking pens. But if you're getting excessive diarrhea with the dose, you may just need to take a step down to the previous dose you're on, or if you haven't, for some reason you weren't, you should have been. You need to start off with a lower dose to kind of get the tolerance to it, and then also overcome that diarrhea.
Yeah, a lot of you know, medications, the start low, go slow works really well for people. If you don't know what that means, it means that you're just starting at a lower dose, get your body acclimated, and then slowly titrate the medication up to where you're getting a good effect. You know, I know I've heard some horror stories. I'm sure you've seen it where like a doc's putting you on full dose semaglutide out the gate, and it's probably not a great idea.
No.
Yeah. So I've seen it in some areas of practice, and I know you guys see it in the retail a lot. So it's always good to like get your body acclimated to what you're taking, and just see. I mean, a lower dose you might not have side effects and get a good effect, and a higher dose you got side effects like crazy, and it's not even worth the positive effects. So
yeah, now you're not even getting what you need out of it. Because yeah, I've seen some doctors, they'll write like the 7.5s. I think it's what, 7.5, 10, 12, 10 or 12, and then 15. And they'll be like, yeah, just give them whatever you have in stock to give them. It's like, that's not how that works. Like, you can't
No.
just take somebody from 0 to 15 milligrams of this shit per injection. Like, are you serious? So be smart with it, guys. Like, if the doc is like, oh, we want to jump you way to the beginning or way to the top, be like, whoa, now, like, let's start this thing at the gate here and kind of start with a 2.5.
Yeah, if you're listening, Cam is like rubbing his face in a very like, oh way, like, oh my goodness. I'm sure
It
that
is
you've seen
some of the shit you see is it blows your mind. Blows your mind.
Oh man. Any last thoughts on the miracle drugs?
They don't exist currently, guys. Like, they're working on them, I'm sure, because the benefits of this medication for those who actually need to take it are great. The side effect of weight loss is nice. They obviously know there's a good market for it, so don't think that they're going to stop there and not try to find something that's going to be ideal. It's just going to take a lot of time, a lot of money, and a lot of science to get there. So just don't be thinking there's miracle drugs every corner. Read the information on them, talk to people about it. Don't just read it and think you know what's going on, because they have to report everything. Talk to people about it, talk to professionals, see if they have any opinions or any specific patient cases they could discuss. And you can't discuss details, but they can give you kind of broad strokes on that, because everybody likes getting a broad stroke once in a while.
Oh yeah. I think that's
yeah.
in this. All right, everybody, stay safe out there with the miracle drugs. Don't buy any snake oil or take any wooden nickels.
Stay out of the gas station medication line.
Yeah, stay out of the gas station market. We do the research so you don't have to.
So you don't die from fucking Spanish fly.
Take it easy, guys.
Peace.